This is Oli Sparasci, who is from the East Lancashire and South Cumbria NHS Trust. And Oli's going to talk about combining research and clinical practice, a psychiatric trainee's perspective on mental health research. Oli.
Hi, thank you very much for inviting me to the session today and for my introduction, and also to Manvi for your really inspirational talk. That was fantastic to listen to. So as Niall has said, my name is Oli. I'm a psychiatrist. I'm a trainee psychiatrist. So that means that I am medically trained. I went to medical school, and after finishing medical school, I chose to work in mental health. And really today, I just want to tell you a little bit about my journey and some things that I've learned from experience. I'm fairly early on in my career, so I don't have all of the answers, but hopefully people will find this useful. So I went to medical school in the UK, and when I was at medical school, I was becoming more and more interested in mental health and mental health research. And I was really fortunate to be able to take a year out and study for a neuroscience degree. So it really gave me a great grounding in the science that underpins a lot of the conditions that we work with in mental health. And then following that, I was thinking about what I might like to do as a research project while I was at uni, and there were some various options, and one of them was a neuroimaging project. So using magnetic resonance imaging to look inside people's brains and to look at whether natural sounds calm people down and make people feel less stressed or anxious. And it was a really interesting study to be involved in. And that really sparked my interest in definitely working in mental health research. And I was really fortunate to be able to do my kind of basic training in medicine. So it's called foundation years in the UK. And there's similar processes everywhere where you do a couple of years of general duties and then move into training in mental health to become a psychiatrist. And I carried on in neuroimaging, and my interest now is really in dementia and trying to develop new techniques to try and diagnose dementia at an earlier stage. And I moved from the south coast of England up to Manchester, and I work in Lancashire now. And I'm really privileged because I get to have a career which involves clinical work, so seeing patients in the clinic, and also research. And I think that that's a really fantastic position to be in as a mental health professional. And so essentially what that means is that for 3 or 4 days a week, I am in the hospital or in the clinic. I see people, and I see people with all sorts of mental health problems, predominantly older people. So I see lots of people who have dementia or may have dementia, and that is fascinating. And it really helps with my research because it means that I can see the problems that people have firsthand. I can talk to those patients, I can talk to their carers, to their loved ones, and I can really understand the problems that they have and get to know exactly what it is that they want the answers to. So trying to work with people like Manvi, people who have that lived experience. And then as a psychiatrist, I can bring that experience from the clinic into the research setting. And it means that I can ask the relevant questions when I'm doing neuroimaging related research. And I can make sure that what I'm trying to find out, what I'm trying to discover, is actually going to have a benefit for people. Because ultimately, as a clinician and as a researcher, we always want to do something that's going to benefit people who have mental health problems. And anything that I can do for that, I think is fascinating. I also have other research interest, and another main research interest, which is COVID. And obviously that's only developed over the last couple of years. And I was really fortunate to be able to get involved in some research related to COVID that's currently being undertaken in Pakistan. And one of the great things that's come out of the pandemic, obviously a lot of terrible distress, but one of the good things is that we've all learned how to use things like Zoom and Microsoft Teams. And so I'm really lucky to be working with some amazing researchers in Pakistan, looking into the impacts of COVID on the people of Pakistan. So what I would say is mental health research is difficult. It can be challenging to get into. Don't be afraid if you get pushed back. You're going to have funding bids rejected. You're going to not meet deadlines for things, and that's okay, because you will get there in the end if you carry on trying hard. If you are a junior researcher working in mental health, always listen to the patients, always listen to their carers, their loved ones, because they're the people who should be driving the questions so that we can make a difference. And finally, what I would say is, if somebody offers you an opportunity to do something, grab it with both hands, say yes. It may not work, it might not be what you're interested in, you can always leave at a later date. But if you're offered a chance, always try and take it. There we go. Thank you very much.